First, we just wanted to thank you again for making time. Today's a busy day. We're really looking forward to your comments on the panel this afternoon, and we're glad we have this chance to kind of ask you a few other questions as well. So the first is, you recently published this evaluation of early childhood development and education programs in China. And we're wondering whether or not there's a tipping point maybe happening, and if we can see or look forward to some big changes in early childhood development and education policy in the Chinese context.
That definitely is a tipping point, and China, as you may know, now has entered a 12 five-year plan period, which spanned from 2011 to 2015. So at the time when we were preparing this report, it was towards the end of the 11th five-year plan. And of course, the goal is to hope to encourage the government to expand into ECD, because we see that ECD is a major gap in Chinese human capital development, if you like. It has a lot to do with the previous emphasis, which is on universalization of compulsory education for 9 years, and expansion of technical vocational education and higher education. All of these are needed for China development. But then the common assumption, and it's not limited to China, but in many, many countries as well, is that young children are better taken care of at home, and then they'll be okay until they need to go to school. Not anymore, because the advances in neuroscience, in longitudinal studies in a number of countries, of which my colleague Mary Young was involved in, has indicated the importance of ECD, whether it is nutrition, health, or early stimulation, and the earlier the better. So it is this shift, both in terms of increased evidence about the importance of this subsector, as well as the shift in understanding, the shift in knowing that there are big gaps which actually provide extremely high returns to the public investment is ECD, and that's why China is now in the 12 five-year plan has set really new target and have a very strong focus on people's livelihood, on poverty alleviation, and ECD is considered to be playing a key role in this overall scheme. Give you some example, which I thought is incredibly ambitious. In terms of the nutrition, we know that China is not developed evenly, because the coastal region are far more advanced. If you go to Shanghai, there's almost no difference in whatever that they offer in amenities and so on with any other big Asian countries. If you go to the western part of China, many of these are high altitude, arid, mountainous, and poor. So with that kind of development, and the Chinese government want to narrow the equity gap by focusing on providing nutrition to young children. And in 2012, they allocated about 100 million renminbi, which is roughly $16 million US, to provide free nutritional packages to all children between 6 months of age to 24 months. And this is going to be continuous. It's not a one-shot. And then there are about 699 counties in China, which is roughly 25% of the total counties, in 8 contiguous mountainous area. As you know, wherever there's mountain, the communication is not that easy, and people, are usually poor. So so this is one new thing, and the money come immediately, and they have invited 100 counties out of the 699 to be in the first phase and to provide nutritional package to these kids. The cost is roughly 1 renminbi per day, which is 365 days a year is all free. In these packages, they are soy powder, so there's protein and other micronutrients which provide vitamin supplements, iron, zinc, and so on. and we know from previous research that rural children tend to be deficient in iron. And so this is hopefully, and iron is also related to the cognitive developments. So, by doing this, it is actually going to provide level playing field for the kids. But if you ask me whether there would be that is sufficient, obviously not, but it is in the right direction. And most recently, Premier Wen Jiabao said that this program should actually expand from 20 children from 6 to 24 months up to 6 years of age. We don't know yet, but the Ministry of Health is also planning to have a enriched parenting training to all these poor counties, so that it would be a combination of nutrition and early stimulation.
That's amazing. I don't think I've heard of a single comparable national program that's as extensive as that. And maybe that brings us into sort of this follow-up question, which is, it sounds like very good policies are being made in favor of early childhood development. And maybe the next question is, implementation-wise, what are the challenges that China will face, especially given its huge geographical terrain, the differences in the mountainous regions and the coastal regions, and how, what kind of challenges we should expect to implement these new early childhood policies?
I think the implementation for this nutritional program, I'm just mentioning one. I mean, there are others, such as school meals, providing free school meals to school-age children. That's a separate program. Now, the school meal program is implemented by the Ministry of Education. The young children's nutritional improvement program is implemented by the Ministry of Health. It's not that China hasn't done this before. There were pilots, and so it's not like going into a totally unknown area. The CDRF, which is the China Development and Reform Commission, Foundation, whose representative Dr. Liu Bei would be talking to you later. They've done, they fund pilot studies in Qinghai and Yunnan. Both are western provinces. Qinghai is high altitude too. So to their nutrition and also early education. So it's building on this kind of experience. And of course, when I work in the World Bank did a study on Hunan and collect data from household of, to see what factors can affect the height, weight, cognitive, and social development of 3 years old. And we found that, better nutrition, better health, better, early stimulation could essentially mitigate the differences between rural, urban, between Han and minority, and between the children whose mother had better education, caregiver, they have better education and they have lost less, and also mitigate the differences in family income. So these are completely doable things, and it is the Chinese government is collecting a lot of evidence. And once they get the evidence that this is a good investment, they go ahead. So yes, it is very ambitious. And on the education side, I might want to add that in the 12 5-year plan, the target is to expand enrollment for the 1 year before primary education, extend the enrollment from 74%, which was the coverage in 2009, to 85% by 2015. And for 3 years of education, they will extend from 51% to 60% within 5 years, 4 years actually. So, on both the education side as well as the nutrition and medical side, you can see this, these improvements. And there is also, we didn't do any research on, but my other colleagues in the World Bank have done this research. That's also on the health side. Rural health insurance has expanded rapidly, so that by 2009 it actually covered 94% of rural residents. These are very, very basic services. But the fact that a health insurance scheme is being set up and explored and can be approved upon in the future is, absolutely incredible.
That really is amazing, and it would be a very exciting thing to follow, especially to see the evaluations of these early nutritional programs. And
yes,
yeah.
If you're asking me about problems, I think that was your question. I went on. The question is that obviously for any there will be teething pain in any kind of programs. But the procurement of the nutritional package is done openly, done by the provinces. But the nutritional package is based on the standards set by the Ministry of Health. So it doesn't matter which company manufacture the package, they would have to cover those nutrition required by the Ministry of Health. I think the one challenge I can think is the terrain. If you're talking about 8 contiguous mountainous area, it would be very, very hard to in terms of distribution. So in their pilot that was done before, they actually because the distribution center is the village clinic, so people come there from time to time. Once they come, they can probably get a supply of many days or maybe a month to take home. The other question might be compliance. Of course, you have to explain the value of this nutritional package to parents or grandparents who take care of the kids, and would they faithfully apply? We don't know. And I think the impact evaluation is important to find out, both the compliance issue, implementation issue, as well as the effect if these are all, these problems are solved.
Great, thank you. And we wanted to sort of close up with this professional question for you, which is you've recently moved from a long time at the World Bank and now at the UNICEF US Fund. And we were curious to see if you think those organizations are treating early childhood development differently.
Right. Well, I actually retired from the World Bank, so my work with the UNICEF is actually quite consistent with my interest in the past in working on children's issue. UNICEF is, the World Bank has its own resources. Besides accepting, contribution from member countries, the World Bank also raises funds in the financial market to act as a bank. So I think that in terms of resources, it has a lot more resources, and in education it does cover a lot more, like essentially from EC, early childhood education and development, to tertiary education, research and development. UNICEF definitely have a more stronger focus on children, and so in that, and then it get involved in a policy dialogue with the government. So even when I was in the World Bank, we very often, invite UNICEF to participate in a lot of these activities and policy dialogues and conferences. So I think both are really, the goal is consistent and it's totally complementary, but the scope might be different because UNICEF is not a bank, per se. It's a development agency. So what it does and what it does not do would be a bit different. But UNICEF is very much also into fundraising, which the World Bank is not. So it raises a lot of funds to spend directly on this program. A high percentage, I think over 92% of the funds that we raise privately goes directly into programs. So, and it's a very efficient way of using money.
Great, thank you. Do you have any other final thoughts to?
No, yes, I do. I really want to take this opportunity to inform your audience how important Professor Heckman's work is in advocating for early childhood development. This pin, which is an abstract design of his famous graph to highlight the importance of early childhood education and development, this is actually so central in the way that the policymakers in China were being persuaded that ECD is the way to go, because the World Bank were invited to provide inputs and suggestions before the beginning of the 12th five-year plan to see, China, what direction it should take, what are the gaps, what are the challenges, and how to overcome them. So the World Bank did provide such these inputs and suggestions, not just to education, but to all the other sectors. But because I was the lead education specialist there, so I was more involved with education. And Professor Heckman's graph was in the in our report to the government, and the Vice Minister of Education at that time, who now becomes the Minister of Education, convened a group of like 50 top experts on education in China, and they reviewed the report, gave us feedback, and then they focused a lot and with a lot of question on this graph. What do you mean by that? Why is it ECD, investment in ECD have high economic return? What is the policy implication? So this graph become very much a focal point for policy discussion. And I think, the 12 five-year plan's ambitious plan was certainly one of the results of his graph. And I told him, but I also want everybody to know that engaging in academic research is not just academic; it has really tremendous, social implication. And the same thing. So when we did this early childhood development in China report, his graph was used again, and this time we have much more evidence and also far more expanded discussion, and the graph really moved the policymakers in China. So I just wanted to share with your audience about this.
Great, thank you very much. It's a good thing to know, and I'm sure a good message for a lot of grad students that are busy with their head down working on research to know that it does have real policy implications.
Thank you.
Great, thank you so much.